Hello, everyone. Today we will study the sacral plexus. First, let's examine the composition and branches of the sacral plexus. The sacral plexus is formed by the lumbosacral trunk, composed of the remainder of the anterior ramus of the fourth lumbar nerve and the anterior ramus of the fifth lumbar nerve, and the anterior rami of all the sacral and coccygeal nerves. It is the largest plexus of spinal nerves in the body. The sacral plexus is located within the pelvic cavity, anterior to the sacrum and the piriformis muscle, and posterior to the iliac vessels. The left sacral plexus has the sigmoid colon anterior to it. The right sacral plexus has loops of ilium anterior to it. Injuries to the sacral plexus are relatively common. They are often caused by the infiltration or spread of malignant tumors from pelvic organs, such as the uterus or rectum. This can result in pain and significant involvement of multiple nerve roots. First, let's look at the branches of the sacral plexus. The sacral plexus gives off branches that distribute to the muscles and skin of the pelvic wall, buttocks, perineum, posterior thigh, leg, and foot. The sacral plexus directly gives off short branches to supply muscles such as the piriformis, obturator internus, and quadratus femoris. Next, we will study the branches of the sacral plexus in layers. Sciatic nerve, L4, L5, S1, S3. The sciatic nerve is the largest and longest nerve in the body. At its origin, it can be up to 2 centimeters wide. It exits the pelvis through the infrapiriform foramen and lies deep to the gluteus maximus muscle. It descends between the ischial tuberosity and the greater trochanter into the posterior region of the thigh. It then descends deep to the long head of the biceps femoris muscle. It usually divides into its 2 main terminal branches, the tibial nerve and the common fibular nerve, just above the popliteal fossa. The sciatic nerve trunk gives off muscular branches in the posterior thigh to supply the biceps femoris, semitendinosus, and semimembranosus muscles. It also gives off branches to supply the hip joint. Second, the surface projection of the sciatic nerve trunk. It is represented by a line from the midpoint between the ischial tuberosity and the greater trochanter, descending to the midpoint between the medial and lateral condyles of the femur. The upper 2/3 of this line represents its projection. In sciatica, tenderness often appears along this line. 3. Tibial nerve, L4, L5, S1, S3. It is the direct continuation of the sciatic nerve trunk. In the lower part of the posterior thigh, it descends along the midline to the popliteal fossa. It descends in company with the popliteal vessels, which lie deep to it. Then, in the posterior compartment of the leg, it descends deep to the soleus muscle, accompanied by the posterior tibial vessels. It passes posterior to the medial malleolus, beneath the flexor retinaculum in the tarsal tunnel, where it divides into 2 terminal branches, namely, the medial plantar nerve and the lateral plantar nerve, which enter the sole of the foot. The tibial nerve supplies the muscles of the posterior compartment of the leg and the muscles of the sole, as well as the skin on the posterior aspect of the leg and the sole of the foot. The tibial nerve gives off branches in the popliteal fossa and the posterior leg to supply the muscles of the posterior compartment, the skin on the back of the leg, and the knee and ankle joints. Its terminal branch, the medial plantar nerve, supplies the medial group of muscles of the sole, the medial half of the sole, and the skin on the plantar aspect of the medial 3½ toes. The lateral plantar nerve supplies the intermediate and lateral groups of muscles of the sole. The lateral plantar nerve supplies the intermediate and lateral groups of muscles of the sole, the lateral half of the sole, and the skin on the plantar aspect of the lateral 1½ toes. The surface projection of the tibial nerve can be drawn from the midpoint between the medial and lateral condyles of the femur down to a point posterior to the medial malleolus. 5. Common fibular nerve, L4, L5, S1, S2. After branching from the sciatic nerve, the common fibular nerve runs infralaterally along the medial side of the tendon of the biceps femoris muscle, at the superolateral border of the popliteal fossa. It then winds around the neck of the fibula, pierces the fibularis longus muscle anteriorly, and divides into the superficial fibular nerve and the deep fibular nerve. The common fibular nerve supplies the muscles of the anterior and lateral compartments of the leg, the muscles on the dorsum of the foot, the skin on the lateral aspect of the leg, the dorsum of the foot, and the dorsal aspects of the toes, the anterolateral part of the knee joint, and the tibiofibular joint. 6. The superficial fibular nerve, after branching off, descends between the fibularis longus and brevis muscles and the extensor digitorum longus muscle. Along its course, it gives off branches to supply the fibularis longus and brevis muscles. It becomes superficial at the junction of the middle and lower thirds of the leg, where it becomes a cutaneous branch. It supplies the skin on the lateral aspect of the leg, the dorsum of the foot, and the dorsal aspects of the second to fifth toes. The deep fibular nerve, after branching off, runs obliquely forward and downward, descending in company with the anterior tibial vessels. It passes between the muscles of the anterior compartment of the leg, continues anterior to the ankle joint, and reaches the dorsum of the foot. It supplies the muscles of the anterior compartment of the leg, the muscles on the dorsum of the foot, and the skin on the opposing sides of the first and second toes. The common fibular nerve winds around the neck of the fibula, where it is superficial and susceptible to injury. After injury, dorsiflexion of the foot and extension of the toes are impossible. Foot drop and inversion occur, resulting in a talipes echinovarus deformity, and the gait becomes a steppage gait. Sensory deficits are significant on the anterolateral aspect of the leg and the dorsum of the foot. Class, today we have learned about the sacral plexus. Next, we will study other nerves.